13. The overseas doctors. Types of registrations. 2 months and 3 patients in the UK are doctors' must registration. With the General Medical Council (GMC), there are several types of registration. Provisional registration is for doctors who have just qualified for medical school in the UK or from certain Area of Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limit registration is for international medical graduates who had not completed the equivalencies of a year's clinical training in the UK. A specialty registration is for medical doctors who have completed specialties medical training and have a certificate of completion of training CCT. The GP registrator is a registrator of a dose excellent to work in general practice in the NHS. Note: for full details of the General Medical Council is www.gmc UK or G. PLAB. Before they can obtain full registration, some categories or overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB designed to ensure those who pass can practice safely. The level of a show is first appointment in a UK hospital. Part 1 consists of reading the test of the ULEN skill and student. Part 2 is a outside structured clinical examination. OSCE is constant of 16 minutes clinical scenarios, no station to assess professional skills. Note: for discretion of PLEB, see www.gmcuk or G. Plan station and advice. Assess the skills. Clinical examination, your ability to carry out a physical examination of a similar patient. A doctor training to play this role will be assessed. Incomparable or intimate examination will be carried out using and making an anatomical model. Practical skill, you will be assessed on practical skills such as surgery and giving intravenous injection. Communication skill, your ability to interact with a similar patient, or in some cases the examiner will be assessed. A skill test may include breathing, but new are given at busy lifestyle. History talking, your ability to take accurate history and make a serialization diagnosis will access advice on the station for the successful candidate. Read the instruction outside each station carefully. You have 1 minute for this. Don't forget the ABC Airways broad circulation protocol in very emerging station. Get in views at the first fracture, like thrusting the sharping in the sharp beam. Check the patient, understand what is happening, then asking them about any concern they may have. Don't just give lectures, listen careful to what the doctor says. Notes: charts are nose and bladders which must be disposed of safely is supposedly contours called a start B. What is the kind registration made the doctors obtain? Look at each option to help you. 1. A new qualified Spanish doctor's provisional registration. 2. A newly qualified new-ready doctor limited registration. 3. A doctor who has successfully completed the first foundation year FG1 full registration. 4. An SHO has successfully completed the foundation program and gained a certificate on completed all training after several special registration plus specialty registration. Reading abbreviation, look A, B, and C option to help you. 1. Any doctor who wants to work in the UK must registration with GMC, General Medical. 2. Some overseas doctor must pass the PLEB test before they can register professional and linguistic assistant board. 3. Part 2 of the test consists of the absence of just extra clinical examination. 4. In any emergency, remember the ABC protocol airways breath circulation. 5. Before you can obtain a specialty's registration, you must have a CCT certificate of completion. Complete before you can obtain specialties, you must have CCT certificate of completion of training. Complete the test, look at B and C composition to help. My name is Musa and I come from Yemen. I came to UK about 2 years ago after graduation become GMA inside EEA and only obtained university GP. When GMC at first, it was very difficult for me to obtain place on a foundation program. And through I speak, I had to take a DLAV test to show that it could work safely in the UK if I had to give in some advisor to other candidates if you were be that and counseling FUM. You shouldn't simply memorize it as paragraphs. It's better to really think about what is you're saying to the actor and get the intention right. After completing my year as clinical trainer, I was able to obtain PLAV OSCE, but I found it difficult to get CSHO plus my chosen specialty pediatric and hospital now had to demonstrate that is suitable with candidate from the EEA owns. I have to complete my second foundation year. I should contain a station which will allow me to approve to CCT with the GMC, an important step of the road to becoming a patient consultant.